Nice to meet you, Dr. Mukker.
Nice to meet you too.
Thank you for your invitation. My pleasure. Podiatry branch of medicine dealing with the diagnostic and treatment of diseases of the foot and ankle. Dr. Mukker, how many years of experience do you and your partners, Dr. Scott, have in what are the main kinds of problems of diseases you treat in your practice?
So I have 10 years of experience, and my partner has about 38 to 40 years of experience treating foot and ankle problems. Majority of the patients that we see are diabetic. The Valley has a huge diabetic Latino population. So we see on average 40% of the patients are diabetic. We also treat kids for flat feet deformities, for ingrown toenails, for onychomycosis, which is the fungal disease of the nails, and fungal disease on the bottom of the feet. We have patients that come in for calluses, and then all the surgery patients. On the surgery side, we have patients that have bunion deformities, so we fix that. People that have hammer toe deformities, so we cut the toe and straighten it. And we have patients that have ankle problems, which we can go in with a scope and then fix the ankle joint. And then sometimes it's done with screws and plates and hardware.
Thank you. Can you tell us about some of the new and evolved treatments in podiatry offered by your clinic, Advances Foot Care?
So one of the newest treatments that we have is the laser treatment for toenail fungus. And it requires anywhere from 2 to 8 treatments, depending on how severe the infection is. We first debride the nails down and make them flat. We run the laser over all of the toenails. It kills the fungus, and as the new nails grow out, they're white, they're clean, no fungus, and it's a simple, easy treatment for patients looking for a laser treatment for their toenails.
Oh, this is amazing. What is required to become your patient for people both inside and outside the United States, Dr. Mukker?
Yes, so we accept Medicare and private insurance. And if you have a HMO insurance or other type of insurance that we do not accept, then we take cash. So there's 3 ways: is the cash, the Medicare insurance, and or the private insurance.
Podiatry treatments appear to benefit those patients with limited mobility and diseases that affect the feet. Who else can benefit? Do active people also benefit from pediatric intervention?
We see a lot of athletes, student athletes, college athletes that have foot and ankle problems. Most of the time the problems are sports injury related. Sometimes they pull their Achilles tendon, sometimes they stretch out the tendons on the bottom of their feet. And so we help them to recover faster, try to prevent surgery in those patients, and do rehabilitation and strengthening exercises so they get stronger muscles and less weaker tendons.
What is acoustic wave therapy, and what are its benefits? Your website states that this invaluable equipment utilizes the
Yes, so that's one of the newest treatments that has come out into the office setting. The first machine used to be done in the hospital, and then they used to put the patients to sleep and then do it because it was so painful. So now the new machine is in the office. It's a small device. It looks like a gun. So they put it to the heel and then they press and go around, and it has a bullet in there that creates sound waves. So that sound wave hits the tissue and it promotes more blood to come to this area and then heal that area. But it feels like a vibration or like a tingling sensation. It's not painful, but it brings more blood flow to an injured area that you want to heal faster.
How many times person would be tried this?
So we do it once a week for 4 treatments over the next 4 weeks.
4 weeks.
Yeah.
Thank you. Can you tell us about toenail disease that you treat, and how laser therapy of the toenails can help clear two fungus diseases?
So 50 million Americans have toenail fungus. 50 million. That's 1 in 6 people have toenail fungus in America. Very, very prevalent. Most of the time, people don't do anything about toenail fungus because it doesn't hurt. If you have a bacterial infection and it is on your skin and it's eating your skin, it causes pain, you go to the doctor. But with the toenail fungus, there's no pain, so you say, leave it, doesn't matter. When you leave it, it keeps eating at the nail, then goes to the next nail, eats it, then goes to the next nail and eats it until all the nails are gone, and then you decide to come to the doctor. At that point, it's a little bit too late. It takes years to fix then the toenails. 1-2 years to fix the toenails. So it's a very long process. And anytime that you notice anything attacking your nails, you should come in right away. If you come in right when you see the toenail getting eaten by the fungus, it takes 2 to 3 months to fix the toenails. But don't wait. And as soon as you come in, there's the laser therapy that's available. You can take the pills, which helps a lot, or you can put the topical, which is for very minor disease. But if you have severe disease, it's the laser and the pills together.
Dr. Mukker, do you tell me what I want to wish you about New Year? Good question.
Yes,
You know?
very good question. Can you repeat that?
What I want to wish you about New Year?
So what I wish for the new year is, I wish for happiness with all of my friends and relatives, and that everybody lives a healthy and prosperous life.
Thank you so much
Yes.
for your interview, Dr. Mukker.
Thank you.